This is Glenn Krauss from Core CDI with our first of many engaging podcasts. I'm here with Dr. Limjoco and Shirlivia Parker. And we came up with this idea for a YouTube channel. Think about where CDI is today. CDI 1.0 is really outlived its shelf life, and we're on a crusade, a revolution to change the trajectory of CDI. So we're calling it protecting clinical integrity, not only achieving, but protecting. And the most important thing I think we agree, Shirlivia and Dr. Limjoco, is preventing denials. Why don't I turn it over to Dr. Limjoco? Well, why don't you introduce yourself, then we'll turn it over to Shirlivia, then we'll jump right in on today's topic of AI and its potential to transform CDI. Okay, Dr. Limjoco, take it away.
Thank you, Glenn. Hello, Cloud. For the past three decades,
Yeah.
I have been dedicated to aligning documentation, coding, and patient care with the clinical truth, collaborating with acute care hospitals and health systems across the United States.
Shirlivia, go ahead.
Yes, hello everyone. So it's nice to be here with you guys. I've been in the clinical revenue cycle space for about 3 decades as well. I'm
Oh,
still in this space, wholeheartedly working with health systems today. As Glenn said, trying to revolutionize CDI to the next
thank you
level.
so much for joining me on our first presentation on YouTube. So I want to talk to something about just briefly today about two areas that we've been discussing as a group here for what, 2 or 3 years? Well, we're speaking at 11 o'clock at night. That shows passion, right? 11 o'clock at night, going full tilt. So we see all this information on LinkedIn and presentations and infomercials and everything about the AI in helping with CDI. So I want to discuss two key points today. Get your feedback on a couple of things here. The first one is this: is AI truly transforming CDI, or simply automating an outdated process? So let me read this to you. Tell me what you think. Discuss this point. AI-powered CDI platforms promise to improve documentation, increasing efficiency, and identify misdiagnosis. But are these platforms fundamentally transforming CDI with the word integrity, or are they simply making the traditional retrospective query-driven CDI model faster? What role should AI realistically play in the future of CDI? And I know that sounds like a loaded question. Olivia, why don't you? We had a conversation on Saturday night of all days on this, so let's go ahead and get your viewpoint on that.
Thank you, Glenn. Yes, we did. And is the new technology out there truly automating the CDI process? I think that depends on the professional who's leading the way, and then the technology that they have decided to implement, right? I am actually working in a health system where we're trying to automate the clinical decision support.
Mm-hmm.
And that's not easy to do because one of the things that I had to do with the vendor is ask them what type of guardrails they have up, right? What type of rules that they put in place to actually allow the system to work. And through that investigation, I came to find out that some of the rules were not evidence-based. And so
What, really?
they were not evidence-based. And so how can it truly be a clinical decision support application
Mm-hmm.
when it's not evidence-based? And so I was allowed to do a lot of work with the vendor to create some guardrails to make it evidence-based, even though it was very narrow. I was able to work with the medical director in our health system to actually test it and pilot it once we were able to make those edits. So I think to answer your question, is it transforming the landscape? I think it depends on the questions we ask our vendors, right?
Hmm.
And
Hmm.
the level of understanding we have in what this technology can and cannot do. Um,
Absolutely.
yes.
Dr. Limjoco, what are your thoughts?
Well, AI is still technology, and
Mm,
technology is a tool. So, with that in mind, there are two big things that play the part of whether we make sure that it works or it doesn't
Hmm.
work. And
Okay.
those two are purpose and context.
Hmm.
It's really important to have the right why. Governance is key,
Yep.
making sure that this tool is giving us the right outcomes.
Hmm.
And second is context. Context is, just like what we used to say in the old days, GIGO, garbage in, garbage out.
Oh, I never heard that one. Well, I know what garbage in, but I never heard a gig. I say, what's that, a new Latin term?
GIGO, garbage in, garbage out.
Oh,
So,
absolutely.
it depends on what the data set has that the AI is working with, and it depends on that data set, what the outcomes, what the success, the favorable or harmful outcomes it can bring. So
Hmm.
those are the two more main important parts in when you think
Absolutely.
about AI.
Hmm. And I just want to add before we jump into the second discussion here. Part of our discussion was what role should AI realistically play in the future of CDI? And I just want to throw this out there through my personal experience, not anecdotally. I see lots of denials coming from AI generated queries. And Shirlivia, you probably see the same. Dr. Limjoco, same in your practice, where it suggests a diagnosis and it gives the clinical indicators that are put into a query. Okay. However, if you look at the record, the clinical indicators, I've always said this, right? Clinical indicators support a diagnosis, but only the doctor can establish a diagnosis, right? Through their charting and communication of what the story is. What is the context? What does the record truly say based on the documentation available? History of present illness, physical exam. I think what the CDI tools are missing is the context. I think Dr. Limhoka, you spoke about context, right? It has to, the record, every record, Shalivia, you talked about, what you talking about, evidence-based. Every record cannot be approachable from a standardized algorithms. Okay, if it's X equals Y, then Y equals Z, then go ask the query. So I think that's part of the dangerous or piece that we have to take into account is I think the word realistically, right? Realistically play. Which drives me to my second point of discussion here. Are AI documentation platforms delivering on their promise?
mm,
Many vendors market AI as a solution for revenue integrity, right? Claiming increased CCMC capture, that's the hook, right? That's the hook. Improved case mix index, okay, which is a gross number, by the way, right? We can make a
mm,
CMI look any way we wanted to, and significant financial return on investment. There's one vendor that claims 5 to 1 return on investment. Do these platforms truly improve the quality of physician documentation and clinical communication, or are they primarily designed to identify reimbursement opportunities?
mm,
Lastly, how should hospitals distinguish between documentation excellence and
Mhm.
revenue optimization? So, Dr. Limhoka, why don't you take a stab at that?
That's a mouthful, Glenn. What comes to mind is something that I wrote about a few days ago. It's about the Southern African
Oh, I saw
philosophy
that.
called
Yeah, that was interesting, Dr. Limhoka.
Ubuntu,
Yeah?
which is summarized by the phrase Umuntu, Ngumuntu, Ngabantu, which means a person is a person through other persons. And I'd like to show how that applies to what we're talking about, which is AI and CDI.
Okay.
And that is, in short, no man is an island,
Hmm.
and no words stand by itself. The only time that words become meaningful is when it tells a story.
Oh, great.
Okay. So that's what's needed in clinical documentation integrity,
Uh-huh.
that narrative transparency. And if AI is going to help, it has to have that in its soul, in its inner workings.
Hmm.
Uh, that's what I have
And
to say.
Shirlivia, I have something to comment on that, but I would like to have Shirlivia give us her viewpoint. Where are you? You're out in Hawaii, right?
I am. So aloha to
Yeah, yeah,
everyone.
yeah. I can use some pineapple right now. Come on.
Mahalo, mahalo.
Yeah.
Yes, yes. So let me add a little bit to what Dr. Limjoco just said. So I
Hmm.
love that premise of telling the story.
Right.
As I mentioned, I'm working to try to implement AI where I am. And one of the things that I think was said in the previous question is AI governance, right? And being clinically intuitive. So we were working on the CKD nudge, or
Oh,
AI
oh, oh,
generated
oh,
query.
okay. I know. Yeah, that's a
Okay.
yeah stage, right? We want to know what's the stages, right?
Exactly what the stage is.
Okay, yeah.
So I'm reviewing records and I'm identifying, is it prompting from a true clinical decision support viewpoint. Through that process, I find out that it was not clinically intuitive at all.
Oh,
It was prompting the provider for CKD stage specificity in an
hmm.
acute care setting when the patient didn't even have CKD,
What?
a
Really?
history of CKD.
Shirlivia, what a surprise. What a surprise.
And so it was patients that came in actually with AKI,
Yeah.
and the GFR was elevated one, maybe two, and then it normalized very quickly, right? The patient received fluids, the creatinine started to stabilize, the patient just had AKI. The patient did not have CKD. And so I
It was
think
prompting the physician for CKD when there was
they
no
were,
clinical evidence?
it was with
Unbelievable.
little to no clinical evidence. So if we would have took that at face value, we would definitely be opening up the door for denials with trying to get the provider to document a stage that honestly didn't necessarily exist. It was a different clinical scenario happening here, and we were definitely not telling the story of that patient. And so I think it's our responsibility as CDI professionals not to roll things out of the box. I always say that.
Yep.
Do your due diligence, review what the system is providing, what
Hmm.
that prompt is truly saying. And I went through it myself. I talked through it with my physician advisor, and we are definitely not turning that on until more work can be done behind the scenes to make the application be truly a clinical decision support arm, because it's not there yet, specifically
Absolutely.
diagnosis.
That's amazing. So I want to close, just comment briefly before we close out here. Okay. On this question, that we already addressed, but I want to give my personal experiences in the last 3 or 4 months. How should hospitals distinguish between documentation excellence and revenue optimization? Okay, and I'm going to answer that by saying revenue optimization is defined as what you collect or what you get to keep after you got paid, right? It's not CMI, it's not CCMC capture rate as the vendors are marketing. AI is the tool. It's how, it's durable, sustainable net patient revenue, right? I can't pay my bills with case mix index or CCMC capture rate. And the focus really should be on documentation excellence, which means sustainable, durable revenue based on defensible documentation, uh, recognizing that payers have a tendency to not accept what you send in. Everything is codable, documentable, codable, and billable. Not everything is payable. Okay, so keep that in mind. Uh, be weary of AI vendors. I'm not putting them down. Uh, Promising revenue integrity, because revenue integrity means you have to achieve documentation excellence. And my experience has been that documentation excellence can only come from physicians' ability to document, chart, communicate in the AI tools, right? And it's going to require intervention on the part of the physician, the clinical judgment, which will be our next discussion. Can AI replace clinical judgment in CDI? And I think Dr. Limjoco and Shirlivia, you've commented on some of my posts. There's no substitute for clinical judgment by the doctor in CDI. So I want to thank you very much. I know Shirlivia is very early in Hawaii, so thank you for getting up early. Dr. Limjoco, thank you. So this is our first. We're going to have many of these short YouTube videos. Like I said, we're going to be focusing on clinical judgment and CDI. I actually have a case study I want to put up next week, on the next one, to say, what are your comments? This was suggested query. What's missing? So once again, thank you so much. If anyone would like to be on a guest on the channel, please reach out to me through my LinkedIn. Please subscribe to my core-cdi.com website newsletter. Follow me on LinkedIn. I don't advertise on LinkedIn. And thanks again. Have yourself a great day. And everyone, just remember, we're on a crusade for the clinical documentation revolution, CDI 2.0. Thanks again. Have a great day. Bye-bye.